Do you feel pain in your face that lasts for weeks or even months? At first, you might wonder, is it a dental problem, a sinus issue? And then finally, someone gives you a name, trigeminal neuralgia. But even with the diagnosis, the medication don't work. Here is the truth. Trigeminal neuralgia is just a label. It means your trigeminal nerve is irritated, but it doesn't explain what's actually causing the irritation. And that's what's missing in your diagnosis. So, what could be irritating your nerve? A local inflammation, a muscle spasm, a scar, a bite problem, something else. There are over 20 possible causes for the same type of facial pain, and each one requires a different treatment. Depending on where and how your nerve is irritated, you may have a typical or atypical neuralgia. Especially with atypical neuralgia, the pain can last all day. Scan shows nothing, medication don't help, and still the suffering continues. But here's the good news. If we understand the pain anatomy of trigeminal neuralgia, we can identify the real cause, even through an online video consultation. I'm a neurosurgeon specialized in facial pain and trigeminal neuralgia. And even though I'm a surgeon, I'll tell you this. Most patients don't need surgery. What they really need is a precise, personalized combination of medications based on the exact location and type of nerve irritation. We follow a step-by-step process. First, you send a short message describing your symptoms. If I believe I can help, we schedule a video consultation and I review your medical records in advance. Many patients feel better within days. Once we've identified the true cause and adjusted the treatment accordingly. You don't need the label for your pain. You need to know what's irritating the nerve. That is the real diagnosis. And once we know the cause, we know the cure. It's not complicated. Just send us a message or read more on our page to see how we can help.